I'll skip to this one and then go back. So I'm Christy Cahill. I'm the Cancer Outreach Specialist at the Colorado Department of Public Health and Environment, and then also work a lot with the Colorado Cancer Coalition, who is one of the organizations presenting this webinar today. So thank you to the Alliance, the Patient Navigator Training Collaborative, the Colorado Cancer Screening Program, and the Colorado Cancer Coalition for putting this webinar on. A little bit about the flow. I'll introduce very briefly the presenters as we go along. We have Chelsea, if you want to wave. I don't know if everyone can see you, and Aicha, if you want to wave. They're going to speak today. So Chelsea's going to go first, and then we'll do questions for her, and then Aisha's going to go, and we'll have question time for her. And at the end, we'll mention the evaluation. So Chelsea is you might have to correct me on your title, the bilingual case manager, sorry about that, for family support services at the Colorado Coalition for the Homeless. So Chelsea, if you want to go ahead, and I'll stop my share and you can share your screen. And you're muted right now, so just be sure to unmute.
Can you all hear me?
Yes.
Great. Good morning, everyone. My name is Chelsea Kestler, and the title she gave me was correct. I'm a case manager for family support services here at the Coalition. And so this morning I'm going to talk to you just a bit about homelessness in general. We're going to give some numbers, talk about barriers to housing, and then I'm going to get into the housing system and how it works and how people get connected to homelessness, and then some of the housing programs that we work with. Why isn't it working? It was working before. Oh, there it goes. Okay, so first and foremost, we kind of need to know how many people are experiencing homelessness, right? The numbers are pretty staggering nationwide. They are, there it goes. So over 500,000 people experiencing homelessness nationwide, and a shortage of nearly 4 million housing units, which is crazy. So basically to resolve all of homelessness nationwide, every state would need to build 214 units per day for an entire year to meet the housing shortage that we have nationwide. And so how do we know these numbers? Where do we get them from? That is the point in time survey, which is basically a 24-hour period nationwide where basically volunteers go out and they try and find as many people as they can experiencing homelessness in that 24-hour period. So we go to places where people experiencing homelessness congregate. That's libraries, that's shelters, that's places that offer services. There's outreach teams that go to camps, go to the bridges, go to all of the places that we know homeless people congregate. And then we just survey them. We figure out the length of time that they've been homeless. We figure out demographic stuff, all of these things are important in terms of figuring out housing solutions across the nation and the state, So I kind of want to give a couple of definitions here. This is only counting people who are experiencing literal homelessness. So that is basically anyone staying in a shelter, an emergency shelter, anyone who is living in a place not meant for human habitation. So that's going to be a car, that's going to be living on the street, that's going to be people living just anywhere that people should not live, basically. And so this only counts them. So this is a massive undercount of people experiencing homelessness. This is done January 28th to 29th. It's a cold time of year. So people often are staying in motels if they scrounge together enough money to stay in a motel that night, or crashing with a friend for a night. This does not count those individuals or families. So this, just for the record, all of these numbers are a massive undercount. So here are the full numbers just for Colorado and Denver Metro. This is where I want to get into barriers and things like that. So I don't know, I don't think I can hear everyone. So I just want to give you a moment, give you a beat to think about, what do you think the #1 reason for homelessness is? just let you like ponder that in your mind for a second. A lot of times we hear mental health issues, we hear substance abuse, things like that. Laziness, there's a lot of stigma involved with all of this. And so I want you to know the number one reason for homelessness is actually a major life event. So that would be a death in the family, that might cause a mental health spiral, which then leads you to be unable to pay your rent and get evicted. That could be an extended stay at a hospital. You get really, really sick and you come out of the hospital a month, 2 months later, and you've been evicted. And those are the kinds of things that lead to homelessness. And so, yeah, that's kind of one of the main things. So that's not to say that the people that we work with do not have mental health issues and do not have substance abuse issues. And, domestic violence, it's obviously another major life event that causes a lot of homelessness in the nation. And so basically, I was trying to get to, sorry, I lost my train of thought for a second. The housing shortage is another big one. So I'm going to kind of move on from this just to get all of that in your mind. And then, so what do we do at the coalition? So we offer housing. There's limited resources for that, and I'm going to get into that a little bit later. We offer a lot of supportive services. So Community Resources is a program for individuals without children experiencing homelessness just to meet their immediate needs. And then if they require more intensive resources, they refer them out to that. PATH is a similar program that is specifically geared towards adults with mental health issues. Our street outreach teams are incredible. That consists of case management, psychiatrists, nurses, doctors who go out into places where people are extremely vulnerable and try to get those people connected with services or just meet their immediate needs. Say they need wound care, stuff like that. All of that is kind of what street outreach encompasses. And then I'm going to get into the housing first model and the social impact bond a little bit later. And there's a ton of other services that we offer, vocational services, stuff like that. And then we have healthcare. So we have the Stout Street Health Center, which is a pretty amazing place. They offer primary care, dental, psychiatry, therapy, an eye clinic, and a pharmacy, all completely free to anyone who identifies themselves as homeless. And so that is a really cool one. There's some satellite clinics, and then there's another outreach program where there's like a big van that drives around to various places around where services are provided, where people can get healthcare there. And so the housing first model is basically just says that housing is a human right, and you don't need to be sober. You don't need to have a job. You don't need, none of that stuff is required for you to deserve a home. And so basically there's a whole system that I'm about to get into that identifies people who are extremely, I never identified chronically homeless or defined that. So that is people who have been literally homeless for a year or a total of a year over multiple times within the last 3 years. So that's the HUD definition of chronically homeless. And so basically this housing first model just basically says you do not need to meet moral requirements like substance abuse and stuff like that to deserve housing. So the way this works, and this graphic is a very idealized perfect world situation. This program has a lot of flaws, and I'll get into identifying some of those. Basically, people fill out a survey with a case manager or someone else who provides services. It's a vulnerability assessment, and it is called the BI-SPDAT. Do not ask me what that acronym stands for. I don't think anyone knows it. But basically, it is based on self-reported data. So the case manager will ask a very invasive questionnaire to these people, substance abuse, domestic violence, have you ever resorted to prostitution? These kinds of things are all in this assessment that they get. And it's really invasive. It's really problematic for a lot of reasons in that it's really triggering for a lot of clients, and a lot of clients don't want to report those things because they're ashamed or they have a lot of just it's triggering, and you don't want to answer that question because you just don't want to. And so the self-reported aspect is really problematic, especially since white communities or white people tend to over-report, and people of color and particularly Black people tend to under-report. And so it's a really big problem affecting a lot of communities of color. But ideally, okay, so you do this vulnerability index, and then your score gets put into a database called HMIS, the Homelessness Management Information System. And then that basically brings up the most vulnerable people, or people who would be a good match with a landlord in a housing unit in a program. And then it connects those people to a lease and the program that they require. And so again, this is a very idealized situation. And so we're getting into housing solutions. Permanent supportive housing is a really amazing program. It's very resource intensive. So these are the most vulnerable people in our homelessness system, who basically require the most services. So substance abuse, mental health, employment, all of these things. This is permanent housing. So they are never going to be kicked out. This is really, they can stay as long as they want or need to. And so these are really cool programs. There are very few units for this, just because it is so resource intensive. Ooh, and I want to go back to one thing on this situation. This is also really problematic in that the people who tend to be the most vulnerable are hard to find, and they're not the people seeking out resources, and they're not the people seeking out services. So they're not going to be the ones who get pulled up for these things, especially when you're trying to capture the most vulnerable people and get them into these permanent supportive housing situations. Next up is rapid rehousing, and this is the program I work under. And this is for people who have been homeless for a shorter amount of time, but they are experiencing literal homelessness. So I work with families involved in this. And basically, say you've been homeless for a month, you're living in your car with your kids or you're by yourself or whatever. They would then get you a voucher. And the voucher is a short to medium length intervention. So the idealized version of this, HUD wants them out of the program within 9 months. Nobody's out within 9 months. I mean, maybe a handful, but generally it takes about 15 months for people to get out, but they can stay in the program for up to 2 years if necessary. And so this includes case management and a lot of things, but the idea is that they would only pay a percentage of their income. So when they come in, the amount is 30%. And so say you are on Social Security and you're making $700 a month. Whatever the 30%, I'm not going to embarrass myself and do math right now, of 700 is what you would pay for your rent. And then slowly, the idea is you would get case management and resources and get connected to vocational services and all of these things to, by the end of the 9 to 2 year marker, you would be paying full market value for your rent. So I'm going to move on to the next one. Oh, sorry. Okay. This social impact bond is really cool. I love this program. I think it's really awesome. It began as a research project done by the Urban Institute. And basically they identified that the people in the city and in the nation who are the highest utilizers of emergency services, detox, criminal justice system, are costing the city a lot of money. And it sucks that it comes down to money, but that's how you get stuff done. But they took 250 of these individuals and who were using all of these facilities. And by criminal justice system, sorry, taking a beat, it is a crime to be homeless in this state, in this city. We have the camping ban. We have, just in general, there are a lot of ordinances that specifically are geared towards criminalizing homelessness. So a lot of these people are in and out of jail. Because I don't want it to be like, oh, these are people involved with like Department of, corrections and stuff. No, these aren't people who are staying in prison for long periods of time. These are people who are just in and out of jail. And that in itself costs the city a lot of money. And so they just took 250 of these people and put them into housing and provided them with a ton of services. This is like really intensive case management stuff because these are people who are extremely vulnerable. And so this has actually been a really successful program. The city has saved a ton of money from this program. And so they've actually doubled down on it to provide or to save more money basically. And again, it's annoying that it comes down to money, but that's how you get the city to do stuff, which is cool. But yeah, so these are the main three things that we refer clients, these are our main three programs. There's obviously Section 8. There are obviously certain clients who are less vulnerable who we just like help them fill out an application for things, for housing and stuff. But these are kind of the main solutions to literal and chronic homelessness. And with that, any questions? I know I kind of blew through it. I'm a fast talker, so if anybody needs any clarification on anything, now's your chance.
There was one in the chat, and if you have other questions, I'll encourage you to put them in the chat. But someone asked, how do you qualify for rapid rehousing? What does that process look like?
So that is part of this whole coordinated entry system. When you complete the VI SPDAT, you're given, it spits out a score somehow. And so I don't know how high it goes, but extremely vulnerable people, I think get close to a 20. And then the people who qualify for rapid rehousing, it's actually a very narrow window of 4 to 7, I want to say. So these are people who are not necessarily chronically homeless, but people who are experiencing it's an immediate intervention, right? It's just to try and get someone off the street as quickly as possible who can potentially sustain themselves in a short period of time with some support.
Okay, so
See the chat. Sorry.
Who developed and administers that invasive self-survey?
So that is actually through HUD. They have created a program called the Continuum of Care, and so Denver Metro has a Continuum of Care, and there's 3 Continuum of Cares, there's 3 COCs within Colorado. So yeah, it's a HUD thing, and I'm sure Ben Carson is the one who developed it. Just kidding. But yeah, so that's really where it stems from, and I think there's a lot of people actually trying to make changes to that, and pretty much anyone who is on the front line of service and anyone who's involved in these programs directly is pretty unhappy with the VI SPDAT, and we all know that it's pretty problematic. And I think there's a lot of people who are working to update that and try and come up with a better solution.
Following up on that, where can a family get the assessment done?
So I know at the coalition, they're through, what's the word I was thinking? Oh, I forgot. Community Resources does them. Outreach workers can complete them. And there are a ton of other places that have case management. It's just any place that provides resources that has case management that's qualified to do it. I'm not sure if you can get it at Denver Human Services. I'm not totally sure about that. But yeah, at Stout Street Health Center, they do VI SPDATs, and in all of our satellite locations, there is someone who can complete that here in the coalition.
So are these only around the Metro Denver area, or are there things outside?
So there are 3 Continuum of Cares in Colorado, and so the problem is that Denver Metro is so big, it's using most of the resources. It is a lot harder to get services outside of Denver Metro. Just to be perfectly honest, rural areas are really struggling. And I know there's a lot of the silent homelessness of the rural communities, which is it looks very different. And so it's difficult to pin down. But there are services, you just have to kind of find them. And I don't know where to find them in rural areas. I can't tell you because I don't know.
Okay, maybe we can follow up with some extra resources after. Okay, there's one. I'm a public health nurse care coordinator. How would I refer someone to you?
Can you say where you work?
In Sunderland is how it's written. Where do you work?
Okay.
Yeah, I'm not sure where she works.
Okay, that's fine. As particularly, so I'm guessing the person that you are,
Tri-County Health Department.
where? Oh,
Tri-County Health Department.
so I would refer people to Stout Street Health Center or just to the coalition in general. There's 3 buildings around here that do community resources intakes, and they can 100% refer clients to, like, there's the front lines. Case management can refer people to the VI SPDAT, and then from there to housing intake and placement, those kinds of things. But yeah, I would just refer them to Stout Street or to just the coalition in general. There's locations at 2100 Broadway in Denver and and then 2111 Champa.
All right, thank you. What does the waiting list look like for each of these programs that you went through?
That's a tough one. Really long. Yeah. Permanent supportive housing is about like 1.5 to 2 years, which is horrible, but it is what it is just due to lack of resources. I'm actually not sure about rapid rehousing just because it is like they're trying to get people like in and out really quickly, and it is just like a voucher, so they don't need to be in a specific facility. Yeah, I just don't know. But in Section 8 is also about a 2-year wait as of now.
Last question so far. Are these programs available for undocumented immigrants?
No, they're not. It's really terrible. But that's just kind of the way that HUD works right now, which is really cool. And that was sarcastic. Yeah, and there's been a lot of talk about, and like through HUD, about not allowing families who are in these programs to have undocumented people living with them. There's a lot of fear, and a lot of the Latin community is actually very underrepresented right now in general, just due to fear of seeking resources because of the nature of what's coming out of Washington right now and the way that these programs are being talked about.
Are there any other questions for Chelsea? She is going to have to hop off after this, so she won't be around for final questions. So get all your questions in now.
I do have one, if I may. So you mentioned that some of these programs do have a bit of an extensive wait list time. So what are some things that you could maybe do in that interim, if there is that kind of emergency situation that comes up? How are we going to help bridge that gap to that wait list?
That's always kind of the question. That's kind of what we're all working towards. I mean, there's shelters, there's emergency shelters, there's voucher systems, especially. I have a client who has an infant, and so through Denver Human Resources has gotten onto a voucher system where she's staying in a motel temporarily until we can get her housed. Things like that. There's not a ton of it though. It's all very limited, and that's where we come back to those 5,000+ people who are experiencing homelessness right now, and we just don't have the resources, and it sucks. But we are doing everything we can. We're providing medical care, we're providing as many resources to try and help this time of literal and chronic homelessness to be as palatable as it can be. It is in itself a trauma, so it's really difficult to pin down how to help people while they're actively living on the street and waiting and waiting and waiting, and that process is extremely frustrating for a lot of people. And yeah, there's not a good answer to that question, unfortunately.
Okay, a few more have come through the chat. How are social impact bond candidates selected? Is it through a prison system referral?
No, so basically they just kind of, here, I'll go back to this, well, whatever. Basically they're chosen randomly. So it is still kind of like it's through like a research project thing through Urban Institute, right? So these are randomly selected people, and they just have kind of gone through records of emergency services, detox facilities, and jail records, and identified just the highest utilizers, and then randomly selected 250, and then they did the same thing for an extra 250. So it seems a little like not humane, right? To just randomly select these 250 people and like not give it to this other guy who was also experiencing all of these things. But that's just kind of the nature of the beast.
Well, you said they were doubling it, right? Because it was so successful.
Yeah. So yeah, they're trying to really like make this program more accessible. But again, limited resources. It's a highly intensive program that involves a lot of resources that are not necessarily available to everybody experiencing all of these things. But yeah, they are doubling down because the city is saving quite a bit of money, like millions.
Okay, a few more. Are the voucher programs only for certain referrers like Denver Health?
Well, so to get into Denver Health, that's more of like a Medicaid issue, or like, so when someone enrolls in Medicaid and they get pulled up for Denver Health, right? Stout Street is in Denver Health's network, but there's no voucher involved with healthcare. That's just like straight insurance. So I'm not sure how to best answer that question.
If maybe it's meaning if someone like a voucher for the housing only available to people coming from certain organizations?
No, so that's part of the continuum of care. So continuum of care basically says if you apply in one place and say the coalition has housing that matches that person, but that person hasn't been involved in our case management, we will take that person and put them into our housing. And the same goes for clients that are in the coalition, that goes to other places. So no, it's not connected to one organization. The continuum of care is trying to be as like egalitarian as possible and not like preference one organization's housing over another.
Okay. Last question about the Stout Street Clinic. How long is the wait list there for medical assistance?
It's not, you can show up same day and get medical assistance there. Just depending on, like, there's no wait list, right? Sorry, just to like clarify, we have like open appointments saved for walk-ins that day. And so you can walk in, and if you're there early enough, which, problematic, but if you can get there early enough, you can walk in for a same day appointment, and you can pre-book appointments with providers and stuff like that. So there's no real wait list there.
All right. Are there any final questions for Chelsea? Chelsea, thank you so much for that. After it's all said and done, we're going to give Erin's email address. And so if people have further follow-up questions, they'll email Erin and she can filter the questions to you.
Perfect. Well, thank you guys so much for having me. I hope I answered everybody's questions to the best of my ability. And y'all have a good rest of your morning. See y'all.
Hi, Chelsea. Thank you. All right. So now I'm going to introduce Aicha and continue on. So Aicha is with Cancer Support Community. She's the director of their Cancer Support Hotline, and she's going to share about open homes and their partnership with Airbnb for medical stays. So Aicha, I will give it to you. I'm going to stop my share so you can share your screen and take it away.
Sounds good. Just give me one quick second. Okay. Can everyone see my screen?
Yep, we can see it, and then just switch it to the presentation mode when you get a chance.
Okay. So hi everyone, I'm Aicha Diallo. I am the Cancer Support Helpline Director at the Cancer Support Community. I have a little bit of a cold, so I cough a little, so I apologize for that in advance.
It's still in the editing mode, Aicha.
Okay. Is this better?
Yes, perfect. Thank you.
Okay, perfect, perfect. So what I'll do today, I will let you know more about the programs that we have available at the Cancer Support Community, and I'll dive into our partnership with Airbnb. So at the Cancer Support Community, our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. So all of the programs that we have available for cancer patients and caregivers revolve around that mission heavily. So we have three pillars at the Cancer Support Community that revolve around the patient. One of our pillars is our direct services, and through that, you have the helpline. So the department that I oversee will sit right there. We have My Lifeline, which is another program that we offer here at the Cancer Support Community, our visits to the website, and our affiliate locations worldwide. We also have our Research and Training Institute, and I'll tell you a little bit more about that shortly. But there we are able to service about 13,000 participants through our Cancer Experience Registry, and we're able to collect more than 1 million data points on these patients. And then we have our policy and advocacy pillar, and we use the data that we collect from our Research and Training Institute to improve our programs, whether they are from our direct services or to look at our priorities for our policy and advocacy department. So we focus on quality access and research, and our grassroots department, our grassroots network has nearly 5,000 patients and supporters as part of that. I mentioned our affiliate network earlier, so we have about 175 locations worldwide. That includes our 10 hospital partners. We have affiliates in 48 cities and 25 states. So you could see on this map over there where we are serviced. And the areas where we don't have an affiliate, we are open to having folks who are willing to either open an affiliate there or want to help us make that happen. And since we have the Cancer Support Helpline available, which is available for the entire country, so no matter where people call from, we're able to service them. So each year we provide $50 million worth of free services to patients and their loved ones. So about 84 cents of every dollar that is donated to the Cancer Support Community goes directly to patient services. So we're really grateful for that. Just to tell you a little bit about what happens on the helpline, we provide patient navigation and counseling as well as national, local, and regional resources. We have a team of oncology social workers on the helpline who and resource specialists, and now a helpline navigator who answer the phone. We're able to provide supportive counseling, housing referrals, financial counseling, genetics, clinical trials referral, pediatric oncology support, and more. And some of those services are also available at our local affiliates. So if you have one nearby, definitely feel free to stop by or refer patients and caregivers over to them. We also have our education resources, our Frankly Speaking About Cancer resources, our award-winning, our signature educational program. These resources can be located on the Cancer Support Community website. They come as a PDF, as a hard copy, or can be mailed to you as well. You can order them off of the website, or you can download them off of the website. We also have a radio show associated with this that our CEO conducts once a month. So you can find topics that revolve around cancer specifics or things such as clinical trials or how to talk to your kids or how to communicate with your healthcare provider. I mentioned My Lifeline earlier. My Lifeline joined the Cancer Support Community in January 2018. It is a wonderful place for people to keep in touch with their loved ones. So it's a digital platform. They're able to go in. There's a calendar there they could put there when their next treatment appointment is. people that are part of their network, and this is a private platform. Whoever they want to welcome into that platform is able to go in there and tell them if they are available on a particular day to help them or to bring them food or to help with anything of that matter, help with rides or babysitting or things like that. A little bit more about the helpline. This is our general helpline, open from Monday through Friday from 9 a.m. to 9 p.m. Eastern Time. I mentioned earlier that we have a team of oncology social workers who provide supportive counseling as well as resources, and our resource specialists. And we also have subject matter experts on a helpline who can answer questions on financial navigation, clinical trials, genetics, genomics, and pediatric oncology. So feel free to refer folks over to the helpline. We also have medical translation services that are available in over 200 languages. So no matter who reaches out to us, we are able to provide those resources to them. We also have a database of over 1,400 plus resources. So even if we do not have a program at CSC to help, we have external resources that we are more than happy to share with our callers so they could get the help that they need. Our Research and Training Institute conducts a research on emotional, psychological, and the financial journey of cancer patients and caregivers. We are able to collect data, as I said before, through our Cancer Experience Registry, also located on our website. So this is a place for people to have their voices heard as well. If they've been going through something and they would like to know if they are the only ones going through something like this, they're able to go in and answer, anonymously answer questions on our general cancer experience registry. There's also a caregivers registry and other disease specific registry that are available that they could go and answer questions, and then the data is released anonymously and they're able to go look at it and see how many people who have answered those questions have a similar journey as them. So that's pretty significant. Our policy and advocacy department, they are located in Washington, D.C. They advocate heavily for access to care for anyone impacted by cancer. They also stress the importance of psychosocial health. So they are on Capitol Hill educating our elected officials on the importance of that. Now, to tell you more about our partnership with Airbnb, you heard all of the programs that we provide here, and you heard that we provide housing referrals. But earlier this year, something amazing happened for us. We partnered with Airbnb to provide temporary housing to patients and caregivers who must travel for treatment. So this has been a huge help for a lot of people, and it has really helped us reach a lot of folks that didn't even know that a service like this could be available to them, and we're very grateful to be able to provide this. So we're able to, since we started, we have been able to secure over 1,000 free housing to patients and caregivers. We've been able to place over 1,000 folks in Airbnb homes. So we've seen a significant increase in helpline calls. And the great thing about that is sometimes people reach out to us for housing purposes because that's the first thing they heard about. And as they're talking to our helpline staff, they find out that we offer a wide range of other resources that could be really beneficial to them. Transportation ask come up, and supportive counseling ask would come up, and more. Even someone looking for a wig, or someone looking for just a pharmacy nearby. So things like that. So we've been able to address a lot more issues as part of this partnership. So we've seen a great impact as well on our organization, and more people finding out about the cancer support community and other departments and our affiliate network and so on. So you'll see here on this slide, there's a story about a single mom who reached out to us earlier this year, who was looking for a home to travel to because the treatment that she needed was not available in her area, so she needed to travel to be able to access her treatment. So she's been very grateful to us to be able to provide that service to her and many, many more. So you will see on this slide that we have a dedicated phone number for the Airbnb program. So when people reach out to us, it goes to the same team of oncology social workers and resource specialists who are answering the phone. But we know exactly where the calls are about. So we know that they're calling for for temporary, sorry about that, for temporary housing. Um, so So this is just to tell you a little bit about the way that the process works. So you saw the number earlier. People will call the helpline. Once they call the helpline, they will make a request. We do get calls about permanent housing sometimes. We know that there is, and that's why I'm so grateful for the presentation earlier that Chelsea gave. We know that there's a great need for that, but unfortunately, this program is only available for temporary housing. So it's important for us to be able to vet the caller, the patient, or the caregiver over the phone, ask them a few questions to see if they would be eligible for this program before we send an application, because we don't want to frustrate anyone either. We want to make sure that before they submit their application, that we don't get their hopes up, that they know that they would somewhat qualify if they provide all of the documents that we need. So there is a short list of criteria that we would need, that we would ask and need in order for them to be eligible for this program. So when they call the helpline staff would ask them the following. They'll find out if they live at least 50 miles away from their treatment center. Of course, we need to know if they do have cancer. They will also have a verification of treatment form that would need to be filled out by a clinician, and that could be an oncology social worker, it could be an oncologist, it could be an oncology nurse. And that verification of treatment form will need to be returned to us. We will also need to check about we need there's a financial requirement associated with this, and on the next few slides I will show you what that looks like. It's 4 times the poverty level, so we will go through those questions with the caller, and if they were able to check all the boxes for them, we will send them the application. They'll fill out the application, send it back to us. Once they send it back to us, we will review and make sure that we have all of the items that we have requested from them. We would also need um, a proof of ID, right? And we will need a proof of, not only a proof of income, but we will also need a proof of address from them to verify that they actually live 50 miles away from their treatment center. So once they're approved, we will go into our HIPAA compliant CRM system. We will put the information in there, and we will also go on the Airbnb dashboard, which is also confidential. So we don't actually put any information in the Airbnb dashboard besides their length of stay, and that's about it. And then their email. Then they will receive an invitation via email. So an email is required, unfortunately, for this. So for anyone who doesn't have an email, we would ask them if they have a family member or someone who can help them create an email address. If they really cannot, or let's say they do have an email but they don't have access to the internet and don't know how to navigate through it, we could do something called the third party booking for them, but they would have to still go through all of the steps that I mentioned before, and we still have to verify that they are eligible for this program. But what that means is that we would go ahead and essentially book for them and then provide them with all the information that they need in order for them to access the home. So the address, if there's an access code to enter the home, the host information, and all of that will be provided to them or the social worker if the social worker was the one who was in contact with us. So when we go into the Airbnb dashboard, the database, we would just put their email address, their length of time. They will receive an invitation once they approve, and then once they go ahead and approve that invite, it will basically open up a page for them to be able to book their home on their end. So they're able to book the home, any home that's available for those dates, and for the amount that we pretty much pre-selected for them, and that amount will be based on where they're going, right? It would also be based on the length of stay. And then after that, once they go and they return, we would be in touch with them. We would conduct a little survey to find out what their experience was and if they need any additional services from the cancer support community. We would also send a welcome packet to the applicant. We will send it to them prior to their departure so that they get all the information that they could possibly need about the cancer support community, if there's any other services that they would need, and then they are aware that if during their stay they have a question regarding their home, they can contact the host. If they have a question for the cancer support community, they can contact the cancer support helpline. So that welcome packet will give them some kind of guidance so they know who to reach out to and what to do while they're traveling and some of the other resources that may be available to them. So since the beginning of this wonderful partnership in March until now, we've received over 6,000 calls on the Airbnb dedicated line, sorry. So as you can see, we're very busy. We are very, very, very busy getting all calls coming in and providing help to patients and caregivers. As I said before, we've been able to house over 1,000 patients and caregivers. So this is the financial requirement that I was talking to you about earlier. So is based on the household size. So you could see if it's a household of one, we are asking them to have a gross income of $48,560 or less. If it's a household of two, it's a little over 65,000, and if it's a household of three, it's a little over 83,000, and four or more, about 100,000. So what happens when folks don't meet the financial requirement? We do have other resources available that we would share with them. Since the beginning of the helpline, we have had a partner that provides discounted hotels to folks who are in need of traveling for treatment. So we still have this partner with us. So we are able to provide that resource in case folks are not eligible for free housing through the Airbnb program. And this is the reason why we encourage people to call the helpline so that they don't just find out that they're not eligible, right? We're able to put them in contact with other resources that they can access. And as I said before, the distance criteria is 50 miles away from the treatment center. So that's about it in terms of the process for this program. Another thing that we have started to do a few months ago, we knew that there was a great ask in folks who wanted to give back to us, who either have experienced cancer in the past or have been housed in another city and who wanted to participate in the open home host program. And what that means is that someone will pretty much donate their home for a certain length of time. It could be a week, it could be a few days, it could be a few months if that home is available during that time, to be just open up their home for someone who would be in need of that. And it's been a little bit of time that Airbnb and CSC have been working together to recruit hosts who are willing to do that for us. We're able to put their home on the platform, on the Airbnb platform. We actually call that $0 homes. And the process is the same. They will still need to fill out an application. We will still need to vet them. We'll still need to go through all of the paperwork and make sure that they are eligible. And to the patient or the caregiver, so the applicant, that doesn't really mean much. Regardless, whether they go through the travel credit, so the grants that we received from the Airbnb program, or if they go through the $0 home, the open home program, it's the same. They will still receive free housing through either program. So you can find more information on that through the CSC website. It has a lot more details on how to sign up as an open home host as well. So you have both information. Anyone who needs to travel for cancer treatment, who is in need of free housing, you can share that information with them, and also let folks know if they are willing to donate their home for a certain length of time so we can accommodate patients and caregivers. So this is just a little bit about the Open Homes host program. So as you see on the slide, so many people need to travel for medical reasons. So this is just to tell people a little bit more about why this program is out there. I know I shared a lot of information, and now it's time for questions. If anyone has any questions, I'm happy to answer them.
Thank you for that. One question popped up, and then I know I have a few too. So how did the partnership with Airbnb happen?
So last fall, our Vice President Joe Biden, um, at a Biden initiative forum, mentioned that it was time to kind of fill in the gaps between uh, the fact that cancer is not just a physical illness, but there is also financial toxicity that is associated with that, and people may be in need of transportation or housing or other things. So it would be great for nonprofit organizations to partner up with tech companies such as Airbnb and really help with some of the things that are much needed out there. And we pretty much reached out to them, and they had just started their medical stay wing. Airbnb has been doing this for some time for folks who needed free housing for either emergency disasters or refugees. So they use that model and thought that it would be really good to do that for folks who were in need of medical stays. So we started the conversation, and they were really excited to start working with us, and we got a very generous grant from them in a form of coupons, travel credit, to be able to provide temporary housing to patients and caregivers.
What is the limit on the number of days you can stay, and can you do repeat stays?
hmm That's a very good question. So, as of right now, we're able to provide 7 days to folks who have to travel for treatment, but we do offer we do offer two extensions. So, three three opportunities to stay. So 7 days and then two 7 day extensions. So essentially, if you add that up, people are able to travel for treatment for 21 days. What they need to do once they provide their verification of treatment form and their application to apply for the first 7 days, if they know that they have to stay for more than those 7 days, they could note that on their treatment of verification on their verification of treatment form, and we will be able to accommodate them for that length of time. If they don't know yet what the additional dates will be for the to qualify for the extensions, we would just ask them to fill out the application for the 7 days and reach out to us for us to provide them with an extension.
Thank you. What other questions do we have about this partnership or about the cancer support community? For the homes that people can stay in, is it the whole home or rooms in a home or a combination of both, like how Airbnb in general works?
Yeah, it's exactly how Airbnb works in general. So folks are able to choose how they would like to be accommodated. So when we send them the application, there's also a form attached to that that is called an accommodation checklist. They're able to tell us there exactly how many people are traveling with them, how many people will be staying in a home, how many rooms they will need, and if they would like to stay in a home. Because some people do want to stay in a home where the host lives there or someone or other people live there. and others just choose to have their own privacy, so they could select that. And based on that, um, the the home of their preference will be available there for them. So the listings will be there, so they could choose the appropriate home for them.
Great. Another question came in. Does the patient need to have a credit card?
No, they don't need to have a credit card because we actually pre-enter the information in that Airbnb dashboard on our end. So we pretty much prepay it for them. So once they get that invitation via email, all they have to do is to accept it and then move forward. But what they do need is an Airbnb account. They will need to create an Airbnb account in
Okay, so
order
that's
to be able to apply for this. Yes. So we do provide instructions on how to do that as well. So people can go in and fill that out. Hmm. And if they're having any issues, we put them in contact with the Airbnb support team who could help them out as well. But yes, they would need to open an account. And if they have a pre-existing account, they can use that as well.
great. Other questions?
I have a question. How far in advance do patients need to start the application process before their treatment, and how long generally does it take to process someone's application?
That's a good question. It takes us about 24 to 48 hours to process it. We would, depending on when it comes to business hours, depending on when it comes to us. So if it comes to us on a Friday night and they have to travel on a Sunday, we won't be able to accommodate them because we don't work on the weekends. So they would need to give us a heads up. So we would need to at least receive the application 72 hours before they have to travel, business hours, so that we could review the application. And if they're missing any documents, we could be in contact with them as well. Or if they're having any difficulties opening up an account, we want to give ourselves as much time as possible, because once it comes to us and we process it, it takes us no time to be able to approve it and send them the invite. What could take a little bit of time is if their application is not complete and if they're having issues completing um, their account on the Airbnb's end. So if they could give us at the minimum of 72 business hours, that would be fantastic.
Thank you.
So earlier you showed the map of all the different affiliate locations. In terms of where you have homes available, is it all over? Like are
Yes.
there homes in rural areas and?
Yes, we do. And if in certain circumstances we are unable to find a home that is very close to the treatment center that the applicant has to travel to, we will look at other areas for them as well that are not too far. So obviously, in some areas we do have more listings than others. In New York City, for example, LA, Colorado, we do have a lot of listings. If they have to travel to some places, it could be a little limited, but we do our best to find them something in the area that could be helpful.
Do you provide instructions in Spanish or other languages?
So at the moment, the instructions are provided in English, but our staff who processes the application is bilingual in Spanish and English, and we have the medical translation services on the helpline. So we're able to walk any Spanish-speaking applicant or any other language for that matter through that system.
Great. That question
But the
reminded me.
application is not yet translated in Spanish. It's not yet translated in Spanish, but we're able to walk the person through it since our staff is bilingual.
Another question about the translation services that the cancer support community provides. So let's say someone's at an appointment and they don't have a translator available there. So they can call your helpline and there's 200 languages available from that 9 to 9 time frame?
So that's not exactly how it works. So just to clarify, this is available on the cancer support helpline. So this is not for every program that the cancer support community provides. I don't know if that's clear enough. So the way that it works is while we provide, if someone calls us for the resources that we have available or supportive counseling that we have available on the helpline, that's when we will use the medical translation services to be able to translate what we are telling the applicant. So if someone is calling us and they need supportive counseling and they speak Spanish, we'll put them in we will put a translator on the line to translate that. So that's kind of how it works.
All
Does it
right.
make sense?
Yes. Any other questions? Aaron had a good question for the audience, going back to Chelsea's presentation. But if are there any people representing the rural areas that have resources that they connect people to for housing, or creative solutions for housing insecurity and what they've done? And if you can unmute yourself if you want to talk up instead of chat your questions. Feel free to do that. And I can. Anybody? And I'll get together with Andy to put together some resources in the follow-up email. There's one chat. Let me see what this chat says. Okay, so Amy just put the evaluation in the chat box. This will also be emailed to you as well. So please be sure to fill in the evaluation so that we can make sure these webinars are meeting your needs and provide you with all of valuable resources for you to get your work done. It'll be emailed to you so you can get that. I wanted to remind people also that on October 28th, there's another webinar for cancer screening and homeless navigation. So join us for that. It'll be in your reminder email as well. Are there, before we close early, are there any last minute questions that anybody wanted to get in?
I think we had one more coming through about Airbnb and if they can accommodate large families.
We definitely can. All they have to do is to make sure that they incorporate that information in the application. So the section where we ask how many people are you traveling with, they will just need to plug in there how many people, and then when they are ready to look for their home, they'll just put that in the system, in the Airbnb platform, and be able to locate a home that can accommodate them.
Great, we had a comment about the rural areas. So we usually reach out to the hospital or facility social worker for housing resources.
Mm-hmm. That's great. We definitely get a lot of social workers who reach out to us about this resource to be able to share it with patients and caregivers. When they're not able to find what they're looking for, they'll reach out to us. So feel free to share that information with anyone you're in contact with.
And then we had another question about the next webinar. So Amy and Elsa, what different content can we expect on the 28th?
So the webinar on the 28th will be focused a little bit more on the barriers experienced by patients who may need preventative cancer screenings, colorectal cancer screening, and other preventative screenings, and some of the resources and strategies to help patients who are experiencing homelessness get in for those screenings.
Thank you. Aicha, two more questions for you in terms of what Cancer Support Community is doing about transportation. How do you help with transportation? And then what are you all doing on the financial toxicity piece also?
Mm-hmm. Yeah. So we do have a transportation assistance program. It was on pause for a little bit. It was for metastatic lung cancer. It was on pause due to lack of funding. Now we just got some additional funding a few months ago. So we are reinstating the program for all types of cancers. So it should be available in November, sometime in November, early December. So folks could just reach out to the helpline and get information on how to do that. But they will need to go through an application process as well, and they will receive a gas card.
Okay.
And in terms of the financial toxicity piece, what we do, basically, we would provide resources to folks and help and pretty much allow them to have access to some of the things that they never even thought could be available there for them. So we would use any internal resources that we have, and we would also use external resources. And we also have surveys that we do conduct to see where people are in terms of that, because the information that we're able to collect on financial toxicity through our cancer support community and network, I would say, are usually information that folks are not willing to share with their physician. So we would run surveys through our affiliate or through our cancer experience registry and really gather that information and be in touch with anyone who filled out the survey and provide some resources that are available to them. And on the helpline, we have a financial navigator. We also have a helpline navigator who is able to provide resources on financial support, who is able to reach out to those resources and make sure that they're still current and that they're appropriate for whoever calls and requested them.
Okay, I hope I understand this question correctly. What are the number of days allowed for the hotel resources? So you mentioned you had a hotel partner that you refer people to.
So it's not just a hotel partner. So it's an organization that we partner with that provides discounted hotels to applicants. So there's no length of stay. What we do is there's no application process associated with that. There's no criteria either. If people reach out to us, what we will do is we would see where they live and where they're traveling to. And we are just able to walk them through the information using that partner's website and let them know what's available in the area that they're traveling to and what's the rate. We will provide them with the information and have them reach out and see. So there's no length of stay for that. It would just basically be based on the availability of that particular hotel or Hope Lodge.
Okay. What about transportation in regard to individuals that are utilizing the Airbnb resource and are far away from home? Can they receive transport to their Airbnb home and then to their cancer appointments and back?
Unfortunately, that's not yet available, but once we roll out this transportation assistance program that was on pause for a little bit, we will be able to provide gas cards to folks as well who apply for this program, who are also applying for the Airbnb program. But as of now, we unfortunately don't have anything available. We're working on that.
Awesome. Okay, any other final questions? Is there a mileage requirement?
50 miles away from their treatment center.
What about for the gas cards that you'll be doing or anything like that?
So there will be a few requirements as well. So since we haven't rolled out the program yet, there will be some more information to share on that. So once we do, I'm happy to provide that information.
Okay, great. Yeah, we'll follow up. We can follow up with this webinar list after with the updates.
Mm-hmm.
For the partner that you refer to for the hotel programs, what kind of discounts how steep are the discounts at the hotel?
Oh, some are wonderful. Some are actually so low that it almost feels that the home is pretty much free, that the hotel or that is pretty much free. So it all depends on where they're traveling to and what's available there. But what we do is we provide a listing, and then the rates are there. So there's some really good discounts, definitely. So for the ones who don't qualify for the Airbnb program, there is another option for them.